Be sure to subscribe to our Solutionaries channel. We're just getting started.
You've probably seen this quote before: "Let food be thy medicine, and medicine be thy food." And that quote is most often attributed to this guy, Hippocrates, widely known as the father of medicine, and he said it way back in 400 BC. Except he didn't. Scholars have looked, and it isn't anywhere in his writings. The first mention of it was in 1926 in a fad diet book from one of the first health gurus in Los Angeles. But just because it doesn't come from the best place doesn't mean it isn't true. Across the U.S., more than 11 million people are considered food insecure by the USDA. But there's another problem. It's what's known as nutrition insecurity. And that's most easily shown like this.
I thought the best way to show this was through Venn diagrams on a whiteboard, because nutrition insecurity is more than just not having enough to eat. It actually breaks down into three things. The first is pretty simple. Is there enough food for you to eat? And is it near you? Usually within a half a mile is best. If you can get there, is that food healthy? A big problem in a lot of cities all across the country. And last is access. Can you get to that food, if at all? A lot of times people don't have cars, and the public transit is bad. Also, access is cost. Some of that food can be very expensive. And in all of these places where this overlaps, you find another problem. Healthcare costs also on the rise, often because people have to spend money to get healthcare, and they have healthcare needs because they haven't been getting the food that they need.
In 2022, the Michigan Food Security Council found healthcare costs from food and nutrition insecurity were more than $1.8 billion every year. And most of those are chronic health problems like diabetes, heart disease, and hypertension. It creates this sort of loop. People can't get the healthy food because they can't afford it, which makes them food insecure, which makes their health problems worse, which means they have to spend money on healthcare, but then they can't afford the food they need. People trapped in this loop of poverty, poor health, and hunger. And it happens year after year. The council saying there is often a perpetual cycle of income restriction, food insecurity, and adverse health outcomes, which is incredibly difficult to break. But there is a program in Detroit working to make food medicine and to help break that cycle of poor nutrition, poor health, and high costs.
When you're in the office and they say, well, to manage your diabetes, you need to eat these foods in this way. And then you realize that you want to manage your diabetes, you want to avoid the complications of, non-traumatic amputations, blindness, heart disease, all of those things that go with diabetes. And yet when you go home, you don't have access to the very things that your provider and your team within the healthcare setting told you about.
Dr. Kimberly Dawn Wisdom is with Henry Ford Hospitals in Detroit. She helps lead programs called Henry's Groceries that deliver food right to people's doors, and a program called Fresh Prescriptions, or Fresh RX, which helps put people on specific healthy food plans depending on their specific needs.
So what happens is when individuals go and meet with their doctor will say, okay, eat better. But oftentimes as physicians, we're not trained on how you need to eat better for your particular condition. So this way, we don't have to have all that nutrition expertise. We actually can refer you to a community educator that we link the person with.
In 2015, the programs started with just a handful of people. Nearly a decade later, they've ballooned to help cover more than 1,300, which in a city like Detroit, where 50% of the residents are food insecure, it may not seem like a lot, but it is a start. And we know these programs really work. In a study in Preventative Medicine Reports that looked at the number from these programs in Detroit, took a look at levels of A1C, which measured blood sugar. Those levels have to be closely monitored for people with diabetes. The study found that just $10 a week for 2 months for fresh, healthy food helped lower blood sugar levels dramatically, while people who didn't get that money saw their levels rise.
So these programs work in a few key ways. The first is just getting people food. Programs like Fresh RX already do that right to their door. Also, making sure that that food is healthy just like before, and also these are prescribed diets. In most cases, the food is healthy even when it's not. The last one is the most important one, education. So often people don't know how to prepare their new healthy food or don't know how to prepare it in a healthy way. These programs try to make sure that all three of these things happen so they can help alleviate some of those chronic issues.
It's not just about food. It's about food that is nutrition dense, that has the right calories, because all food is not the same.
In places all across the country, there are plans like Henry's Groceries and Fresh RX, and during the pandemic, they were invaluable, but they simply don't go far enough.
Okay, one more Venn diagram. It seems like this should be a thing that we can solve on a wider scale, but there are major hurdles standing in the way. The first is funding. So many of these programs are cobbled together by grants and donations, meaning sometimes that money can dry up or they have to meet strict standards. The second is insurance often doesn't cover these kinds of programs or these diets, only in cases that are really specific, like after weight loss surgeries or people with wasting conditions. Finally, it's follow-up from doctors. So often a doctor will prescribe a new diet or say you need to eat healthy, but then not be able to follow up with their patient, or that patient falls through the cracks, and tracking them down can be time-consuming and really expensive.
So even if Hippocrates didn't say food is medicine, he's definitely famous for something else, which makes this all come full, circle. The oath that doctors take, the Hippocratic Oath, is named after Hippocrates, and it says do no harm. And that's exactly what programs like Fresh RX and Henry's Groceries do. No harm, with the hopes of erasing this problem for good.
Solutionaries needs you to be part of the conversation. Your comments below will help us tackle new topics and track down solutions. And don't forget to subscribe.